Ready.
Did you press play?
I did.
Oh, I normally get the cool little finger. Thank you for the acknowledgement. What's up, everybody? This is Mike from Kalkstein Chiropractic. I've got Jordan here with me. So Mr. Belford, he has been having, you see what I did there, the Jordan Belford song? I hope some of the viewers picked up on that. Jordan has been having some knee pain. Well, not been having it. He's been having it for 15 years. Tore his ACL, a little bit of trauma with the knee. At this point, Jordan was telling me the only thing that really fires it up, the only thing that really flares it up is squatting. Obviously, in conjunction of overcompensating and just loading the patella in general, he's been having some discomfort, a little bit more heightened than usual. So we've been attacking this problem of Jordan's with some dry needling, and today is going to be the first time that he gets our Focus Shockwave. So I'm sure based off of our previous videos with doing the knee, we'll have some fun responses from Jordan, but hopefully, more importantly, we can not only lock down the problem, maybe give him a little bit of relief. So today with our video, because again, this is his first time ever getting Focus Shockwave, we're going to do a little bit more of an exploratory route. We obviously know where his sites of pain are. We know where the ACL is, but again, he's never had it before. And like we've seen in previous videos, we want to follow that whole posterior chain, really hit the connecting tissues well. So for Jordan, we're going to just blast away all angles of the knee. And after this treatment, we'll kind of know from there, okay, these are the areas that we're going to focus on. These are the areas that we're going to really give some attention to. So today you can kind of expect a little bit longer of a treatment because of that more exploratory nature in it, but also we're going to just be kind of talking about what happened to the ACL, what was our history, all that fun stuff. So without further ado, let's go ahead and get started. And Jordan, this should be a relatively easier spot that we're going to start on. We'll just give a little bit of attention to the quad. I'm going to start off pretty low, shouldn't be too bad pressure-wise, and we'll just slowly start to work up from there, okay? So right now we're feeling pretty light, right?
Yeah, very much so.
Perfect. All right. So how are we feeling as we're getting close to this knee? You feeling anything yet?
A little bit more, yeah.
Still a little light though?
Still a tiny little bit light, yeah.
Okay. And this is definitely going to be one of the spots that he probably doesn't have a whole lot going on in. But again, we're just going to hit kind of all the angles and really just document what we find. Pressure-wise, are we about maybe a 3 or 4 out of 10?
3 or 4, yeah, for sure.
Okay, gotcha. Now you just let me know when we start finding areas that are a little bit more intense or maybe a little bit more sensitive, okay?
Yeah, it's a little bit more intense on that side.
Right there?
Yeah.
Gotcha. So that's already our first spot that we found. We'll give a little bit of attention to this area, play around with that angle some. But all of Jordan, or majority of Jordan's problems, if I had to guess, is going to be right where my finger is, and then even the sides there. But that's going to be where our heavy spot is, if I had to guess.
That's quite intense on that side.
Pretty intense?
Yeah.
Is it worse than like a 4 maybe?
Yeah.
Okay, so we're going to try this because that spot that I just pointed out is going to be a little bit more bony. So I'm going to go ahead and switch off our stand. And what I'm doing here is basically changing the depth of the Shockwave. So we're going to go ahead and put a little bit bigger of a head on. You can see that's what we're putting on. We were just using this one. The bigger size means that the Shockwave won't penetrate as deep. And obviously when we're over top that bone, we don't want to be penetrating into the bone itself. So we don't need all that penetration depth. We'll go ahead and change this. And Jordan, I'm going to go into that little bit more problematic area now.
Okay.
And we'll kind of ride it from there, okay?
Sounds good.
So let's go ahead and start you off right here. How's the pressure?
It's quite intense there.
Quite intense?
Yeah.
You want me to lower it some?
Yeah, maybe, yeah.
Okay, so let's get him a little bit more gel here, just because we changed the head. And let's lower it down. All right, so I'm going to start off on that side again where we just were. Is that better?
That's better.
Perfect. Still pretty intense though.
Yeah.
So Jordan, what'd you do to the ACL? Let's talk history.
So I did it playing soccer, football as we call it back in the UK. Yeah.
And so 15, you were in high school? Or?
I was in high school. I had dreams of playing professionally, but when that injury happened, that kind of ended any hopes of playing it any further. So
yeah.
But when you're 15 years old and there's other responsibilities that come into life.
Well, I feel like that's one of those interesting injuries too, because 15 years ago, the ACL, the LCL, all of those big knee attachment injuries, I feel like were very much so career enders.
Very much so.
And it's such an interesting thing now that we see patients every single day that have tore ACL, LCL, MCL, and they're still athletic. They're still playing collegiate level sports. That to me has always been something that's just really cool, like seeing a career-ending injury that due to science and breakthroughs in technology, we've actually been able to turn around now.
Absolutely. Yeah, and then obviously the need to strengthen the surrounding muscles for it as well.
Mm-hmm, exactly. So is our most intense area so far, is that right in here where the belly of the problem is?
You're pretty good there. I'd say it's more on the lateral side of it, or the sides of it.
Okay, so more right up in here.
Right there, yeah.
Gotcha. So the Shockwave is a little bit different when you are actually getting it to a spot that you have a problem in, huh?
For sure.
Jordan has gotten Shockwave in the office before, but it was just in a little bit of like a, this is what Shockwave feels like kind of tutorial. And if you've ever gotten Shockwave before, either radial or focused, you will know that it feels quite different over healthy tissue versus over problematic areas, sites of tendinopathies, etc. So quite a little bit of a different experience once you really start treating an area versus just feeling Shockwave. So I'm gonna go a little bit onto this side. How are we feeling here?
That's feeling good.
Okay, not as bad as that spot we were just in.
No.
I mainly just want to see, Jordan, if we can find anywhere that's worse than that spot or it matches the intensity. I imagine we're not going to, but we really want to explore all our angles here. So I'm just having to be real careful. There. Pretty intense right here?
Yeah.
Just having to be real careful to not go over directly through the bone. Now, a lot of these areas we're not going over, straight over the bone, but we have to think there's just not a lot of muscle in this area. There's not a lot of soft tissue there. So even though it might not directly be over that bone, it is still going to be pretty sensitive. So we definitely have to watch out where we're kind of putting this thing. So when you squat, is it right here that all the pain is at?
Yeah, right at the top of that tendon, that patellar tendon.
Mm-hmm.
Yeah, so predominantly flexion of the knee.
That's right there. Can you do an unweighted squat and still feel pain? Or is it mainly as you start to load the...
It's mainly externally loaded, yeah.
As you start to load it?
It's still present unweighted.
Okay.
But it's when you add an external load to it that yeah.
How does it feel when you're doing like rear elevated split squats?
Same sort of sensation, yeah, as a regular.
Does it make a difference if you contra-load versus, laterally load or anything like that? Or
not particularly, no.
Not particularly?
No, same sort of sensation.
Just as soon as the patella gets loaded?
Yeah.
Okay, so we are almost done here with the treatment. I'm just really kind of blasting that site of the patella tendon just a little bit more. And then afterwards, we're gonna have Jordan stand up. We'll just see if he notices any change in his squat. Now again, this is a consistency battle, especially when you're talking a 15-year-old injury on top of somebody who's athletic, on top of somebody who does daily wear and tear with their exercises, etc. So seeing major results in one session would be pretty wishful thinking, but we still want to retest just to see if we've noticed any change at all. So that's our full session, Jordan. Let me go ahead and wipe you off real fast, and we'll just see for the video's sake and for our own sake if we have any difference in loading that knee. Let's not worry about doing weighted, but let's just maybe bust out 5-6 reps of unweighted and see if even tension or anything that we normally would feel is still present. Get this all wiped off of you. I gooed you up pretty nicely. Let me get a fresh one. Alright, so go ahead and hop up for us and let's test that squat real fast. And there you are. Take your time. How's it feel as you hit that bottom and you really load that joint?
Yeah, it feels, it's not as intense as it was before, for sure.
Not as much tension behind the patella itself.
For sure, yeah.
Okay, well good. So,
Yeah.
Jordan, honestly, I would
treatment.
let's talk to Dr. Brady about it, because obviously we don't want to change your modalities you're getting, but I would say we need to start adding in a little bit of focused shockwave for your treatments.
Sure thing.
All right, well, everybody, that was another focused shockwave video. I've got Jordan with me. This is Mike. We'll see you down at Kalkstein Chiropractic if you ever want to get some focused shockwave or just hang out with me and Jordan, maybe do some McKenzie's with us. See you next time.